when I came into the United Kingdom. I came in as a doctor of optometrist, over 10 years of practice, having nurses maybe even serve after me, being head of department. And here I am in the United Kingdom, and I'm looking for a job. I am looking for what I'm supposed to be doing. And then I get into, I'm staying with my sister and we're thinking, what am I going to do? I'm going for all these interviews to get a job as an optical assistant, even, or an ophthalmic technician. Nothing is happening. And then I just get this job in the hospital to be a healthcare assistant. And here I am in that particular place thinking about what am I going to do with my life? I don't want the skills that I have. This is not where I want it to end. And I meet people, that are from, the African community that have come into the UK, and they're telling me they've been in this job, which is the healthcare assistant role, for over 10 years. And I'm thinking to myself, no, that's not going to be my story. And I begin to look and I said, okay, if I can't get into optometry because I didn't have the information, I am going to go into medicine, go back to school and study medicine. And I continued on that plight. Somehow a door was open. I got a job as an optical assistant. And each time I'm in on the shop floor, I'm really hoping and thinking about how can I really get back into the consulting room. And so I'm meeting different people. They're coming in, they're doing handovers. I'm very close to the consulting room, yeah, but I'm not inside the consulting room. I don't know how many of us can resonate with that story. And then not until one day, so I've come back into the UK 2012, and then this is 20 I came to 2012. This is 2014 August. Yes, this lady comes into the store where I was as an optical assistant at the time, Vision Express in Southend, and she's doing handovers. She's actually from Nigeria. I didn't know that at the time. And then I ask her a question and I say, where did you qualify? And she says to me, I qualified in Nigeria. And that was it. And that was it where I began to she directed me to the places where I needed to go for tutorials, the things that I needed to do as regarding my logbook. And that was how I went in and sat my own competency exams, which was June 2015. I sat all the competency exams and I was able to pass first time. And I share that to say to you that the time that we're going to be spending in these 5 days, I'm going to be equipping you and giving you the roadmap, things that you need to do in order to go in and pass the GOC interview. And we all know why I'm really passionate about this GOC interview, because I feel back in my time, if this was what we had, it would have been so amazing, because it's an invitation for you as an international optometrist to have a chat with the assessors over Zoom and then do well, showcase your clinical competence, and then it opens the door. If you're even in the international community, you get sort of a number, a GOC number, that then gives you the right to apply for a pre-registration job in the UK. And these employers in the UK, they are able to give you visas for yourself, for your family, and you travel into the UK and you start practicing even under supervision. And then in the process of time, you have your full GOC number that will then lead you to begin to work as a full-fledged qualified optometrist. Your earnings are high, your experiences are high, and you're able to be a better blessing to your family, to yourself, and you just continue to grow and do your own contribution to Vision No Blindness. You're contributing to this, to the optical space. And so it pains my heart when I see a lot of people take this lightly. A lot of international optometrists have taken the GOC interview so lightly that it's led them to thousands of pounds in adaptation courses that they can't even fulfill because of lack of visa, because of the cost involved. Some others have decided to end their journey there. Like they went into the interview hall and they came out with a closure, saying, "Well, we that's the end of your journey with us. Thank you so much for your interest in working as an optometrist in the United Kingdom, but that is the end of it." Whilst there's some good others that have taken that step and they are moving, they've done it well, they've gone in there, they've received a good outcome, and they are thriving in the United Kingdom. And that is the story that I want to bring your way today. I want to thank all of you that are here right now. Thank you so much for coming in. I'd like to encourage you to go ahead right now and put in the chat for me hashtag live if you're watching live and hashtag replay if you are on the replay. And let me know where you're watching from, number one. And I also want to know where you are in the journey. Okay. If you're bold enough to let me know, I know some of us are doing the interview again because the way the system runs now, you have an outcome. Maybe those that could not fulfill the outcome of adaptations and all, after 2 years, everything runs out and then they go back into the system. So it'll be interesting to know if you're here and you've done the interview before and you're doing it again. In case you don't know who I am, my name is Dr. Lisa Cosmos and I'm from ACN Academy, and I did make a commitment the beginning of the year to help 100 international optometrists gain UK qualification in the UK. There's some other sectors that they will say they're going to help 1 million, they're going to help like thousands, but our numbers are not much. And I feel if I am able to impact and help contribute even my own little source to an international optometrist journey, then that would be amazing. And my calling is just to ensure that I provide that roadmap. I provide the learning space, and that's what we do in the academy, where we provide the learning space where you go through tutorials, mock interviews, practical sessions. I think our next practical session is actually on the 3rd of October. You come in and you learn and you grow. I'm also saddled to providing these free trainings on my YouTube channel, Facebook, Instagram, LinkedIn, and then I do afternoon lives on TikTok. Our major day for lives is on Tuesday, lunchtime TikTok, and evening 7:30. But this week we're doing a sprint, a 5-day sprint. We started yesterday. Today we are moving on to talk about the 8 competencies that will make or break the GOC interview. Now, I want to say to you that it's going to make, somebody say, it's going to make my GOC interview. It's not going to break. No, it's going to make. You can't listen to me. You can't be in my space and still go out there and allow competencies, let's say common competencies, to break you. So let's say it's going to make me. Yeah. Okay. So these are the exact areas the assessors will be assessing you on. These 8 competencies, you don't need to go outside the 8 competencies. You need to focus on them and go deep in them. Make sure you understand them. And I'm going to help you do that on the live today. Is that cool? Is that something that you are excited to learn? Okay, cool. Awesome. Right. So, okay, hello, Ravi from Nepal, okay, in UK, about to complete my master's in public health, okay, and then you will start your journey. Amazing. Ravi, just put in the comment for below for me. When are you rounding up your masters? I just want to know, when are you rounding up those masters? And all of you that are here right now, I say thank you, thank you. All right, so let's get started. Um, Now let's talk about why this matters, okay, in the big picture. So your GOC interview is definitely not a tick box exercise. I think you already know that. It's the bridge that you're going to use to get into the consulting room as an optometrist in the UK. So it takes you into your pre-registration year and ultimately your career in the United Kingdom. It's the gatekeeper. That's the way. Okay. The common struggle I see with international optometrists that don't come out with desired outcomes. And I think this is really on point because for those of you that are on LinkedIn and you subscribe to our newsletter, today we talked about the 5 outcomes you can get in your GEOS interview. And I'm just going to do a little recap of that so that as I'm teaching this evening, you have a clear understanding of the type of letter you want to receive. And for those of us that know how to pray, you know how to manifest, these are the kind of results that you want to start manifesting. Right. I am just going to, okay, good. Let me just get that. Awesome. Okay, now what are the outcomes? I'm going to speak about the outcomes from the desired, no, from on the least desired to desired. There are 5 outcomes in all, but you can group them into 3, but I'll give you the 5. The least desired is closure, rejection, where they either from from the self-assessment form or from the application form or from the interview, they close the case in that they say, okay, we've looked at your experience, we've heard you speak on the interview, or we've looked at your experience you filled in the self-assessment form, and you do not qualify even to start the process as an optometrist in the UK. Or they speak to the candidate to say, we've looked at your form, the evidence you have does not showcase a broad spectrum of the clinical competence covering the 8 competencies, and so they were closing that case. Or that candidate goes into the interview hall and they ask questions about the same 8 competencies, and obviously that candidate has not showcased clinical competence to even, I would say, even a 50% level, and they just say, actually, there's no point of sending that candidate to go do other courses. We just close the case there. So that one, no one needs that. The next level up from that is adaptation with trailing competencies. And adaptation simply means this. The candidate has gone through the interview and they say, okay, not good, but not really bad. And so you need to go to a university here in the UK and get knowledge regarding that particular competency. And sometimes it's even a segment of an indication in a competency. And then they say when the candidate finishes that training in university, when they go into their pre-registration year, they need to still, with their supervisor, with their assessor, begin to work on trailing competencies. Trailing competencies would mean that the candidate has shown somewhat knowledge of that competency or the indicator in that competency, but has not shown mastery. And so it's something that needs to be worked on. But they don't need to go to a university to do that. They can actually just sit in whilst they're doing their pre-reg year, and then they gain that competency. The next level up would be adaptation only. And so again, same applies, but this time around, once that candidate finishes adaptation, they go straight in to do their pre-reg year, and they don't have any training competencies to work on. The next one up, and I say for the last 2 that I'm going to mention, is a very good outcome. And it's a very good outcome because you're not spending extra money going through adaptation courses. You're not wasting time as well, looking for a college or looking for a school and all the other things that goes with doing an adaptation course. And so if you're listening to me right now, whether on live or on the replay, you want to embed it in your mind that what you need to do is to pass your GOC interview first time. And so the other 2 would be proceed to pre-reg with training competencies, and then proceed to pre-reg without training competencies. But regardless of those two, you're still going in. I've seen people that don't have training competencies, that have training competencies, get pre-registration placements. People that have even done adaptation, they've gone ahead and they've gotten pre-registration placements, and some have long finished and are long thriving in the UK. So if there's anything I'd even want to say to you while we go through the teaching this morning, this evening, is you want to have a positive mindset. I want you to say to yourself, I will pass my GOC interview first time. That was the kind of mindset that I had. In our time, when you see the result sheet, what they write there is attempts, first attempt, second attempt, third attempt. And I remember going into that competency hall, because in my time it was, you go in personally, and the gentleman is still working there, so I'm not going to mention his name, said to me, so what attempt is this? And I told him, I do not attempt exams. I have come here to write this exam and I will pass first time. And that was my testimony. First attempt, 7 competencies passed. Proceed. It wasn't even a proceed to pre-reg at the time. It was, that is your GOC number. You're now fully qualified in the UK. Go and start practicing. That is the kind of mindset that you need to have. So even before we begin to work and talk about, a deeper dive into the 8 competencies, every success starts in your mind. You need to have a strong mind. You need to have a positive mindset. I don't care. I didn't even want to care if the seniors, or everyone in Nigeria was going in there and not doing it first time. I had a positive mindset. I knew that God was going to help me, and he led me, and I was moving anywhere there was a tutorial. I was there. I would study. I would practice. I was very intentional about what I said, my affirmations, and I went in there by the grace of God, and I came out with a positive outcome. So half the battles are actually won in your mind. I have coached people in the academy that have come in, and they are so blocked with fear of failure that they can't move forward. But I'm not going to dabble into that right now, because I've got a whole teaching on that next Tuesday, the hidden roadblocks. You don't want to miss that one. Now let's go deeper. While you're listening to the stream, if you have any questions, put it in the comments below. Thank you so much for coming in. I want to know where you're watching from, and I want to know what stage you are in the process. If you have an interview date, let me know in the comments below as well. And if you've paid your 455, I'd like to know in the comments below as well. Right, let's get going. So the 8 competencies, I'm just going to list them and I'll speak about them, okay? So let me just check. I'll just be checking the chat. Is it okay now? Okay, finishing November. I can only hear your voice. All right, Ravi, let me know. Am I back? Am I back? All right. Okay. What I want to say as well, everyone listening to me on the live, you want to stay to the end, because I'm gonna do something. I'm going to, yeah, be on the live, be active. Let me know who you are. At least I know that I've got Ravi here. I've got one person here, Ravi from Napel. Thank you so much. And let me know if it's on post. Okay, let's get going. Right, so competency 1 is professional conduct. Okay, now this means ethics, safeguarding, integrity, patient safety. And there are different ways they could ask this sort of question in the interview hall, such as they could talk about someone with learning disability that has come into your practice. How do you modify the practice for someone, that has a particular issue? It would, so raising concerns, confidentiality, child protection, geriatric patients, maybe you are referring someone for for something, and then the patient doesn't really have mental capacity to make their own choices. They've come in with a family member, and the family member is saying, um, no, they don't really want to go for that referral. My key tip here is when they're asking you questions, you always need to think what protects the patient first. So they're going to be asking you questions to check if you understand safeguarding, if you're able to maintain and bring up good clinical judgment when it comes to patient safety. Okay. Now, number two is communication. And I want to say competency one and two is the thin thread that flows through all the competencies. How you professionally talk about the case. Do you understand your boundaries as an optometrist? Do you know how to signpost to other members of the medical team, putting your patient first? So in communication, we could talk about empathy, we talk about plain language and clinical language. So you need to be actively listening to what the assessor is saying. Are they asking you to explain and talk to them as clinicians, or are they asking you to explain to, the patient? And the rule of thumb here is to understand how to explain to the patient that is 8 years old. Once you can explain any concept to someone 8 years old, then you know that you've grasped the concept. Okay. So a simple example could be a patient who didn't understand a glaucoma diagnosis, and then they expect you to explain it simply. Tell your patient, how you will explain to them that they've got a glaucoma diagnosis. So you need to then switch. I'm not going to be talking about notching off. I'm not talking about visible lamina cribosa. I'm not talking about nasalization or the visual fields. I'm just going to be talking about the loss of visual field, and the damage to the optic nerve, using anything at all to something. You could bring up anything at all to explain to the patient that this particular organ, which is the nerve, doesn't regenerate. You can use anything at all, like maybe a shattered glass cup. When it's shattered, you can't bring it back together again. This the same way the nerve is. No matter what we do, we can't bring the nerve back. But what we want to do is to avoid further damage. Do you get that? Awesome. As I'm going along, if you have any questions, put it in the comments below. Now, number three is methods of ocular examination. Now, this would mean the systematic and everything in between with all the tests that you do, from your VA, pupils, external, internal, all that. How do you conduct your examination? Whether it be the slit lamp, ophthalmoscope, tonometry, when does it apply? What are the normals? Do you get what I mean? What are the normals? What are the techniques, calibration, and all that? That's all covered in ocular. That's all the things that need to weave in. And actually, number three, methods of ocular examination, weaves into number four. Okay, I can see that I am static. Okay, your screen is paused. I can only hear your voice. Okay, so let me see what I can do. I am going to refresh the screen, even though I am not. Stay on page. Let's see. Right, bear with me for the network. I am just trying to refresh the page, and hopefully let's see. Ta-da-da. Okay. I think my network is quite bad, but can you hear my voice anyway? If you can hear my voice, let me know. Okay, maybe I'm there. Good. All right, let's move. So ocular appliances. Ocular appliances will then be, you need to this particular competency will be assessing you on glasses, lens type, prism, coating, dispensing. I know an example of a question would be maybe talking about a patient where prism correction was dispensed for double vision. Okay. So you need to understand everything about ocular appliances. What type of lens form is used for different prescriptions? What type of coatings? What is it for? How are they measured? You know, dispensing for different vocations. Okay. Because they could give you a case scenario of a patient that is a particular age, maybe a 6-year-old patient that's coming to your practice. He plays golf, he's a lecturer, he works with a computer screen at 50 cm, and they ask you questions based on how would you see the patient, what would you dispense with the patient. And always remember that when you're discussing any cases, it's going to be patient facing first. Okay? Patient facing first. I apologize that I'm static. I do apologize that I'm static. But I'm glad you can hear me. Okay, Chinonso says yes, I can hear you. Emmanuel, yes, I can hear you. If you can hear me, that's all that matters. Okay, let's keep going. So competency 5 is contact lenses, and it's everything about contact lenses from pre-assessment to complications. Okay, so your fitting, aftercare, complications, RGP, soft lenses, specialist lenses. So that is what they're going to be assessing you on. So make sure you go deep, understand your lens bank. What sort of lenses do you use in different cases, both for spherical, toric, presbyopic patients? Okay, right. Competency 6 is binocular vision, competency, incompetency, the squints, the phorias, tropias, accommodative disorders, vergence disorders, and all in between, all the palsies for your incompetent, the Duanes, the Browns, and all that, and how you manage. Yeah. Competency 7 is assessment of visual function. And this would cover refraction, visual fields, contrast sensitivity, glare sensitivity, and all in between as well. So a question could come up to say a patient has come in with unexplained reduced vision, even in new glasses. How would you handle that? Yeah. So it's good that when I always say, when you're thinking about all the competencies, you want to think about the different age groups that you're testing. So for visual function, let's talk about VA, visual acuity. What particular tests chart would I be using for a 3-year-old? What one would I use for a 6-month-old? What are the type of tests that I can do if the 3-year-old doesn't want to look at the preferential looking chart? Do you get what I mean? And then what are the normals? What is the normal VA for that, age range? What about how do I test stereo acuity in different age groups? What is the normal? These are the things that you need to, cover. And finally, the assessment and management of ocular diseases from exterior, anterior, or exterior lids, lashes, back down to the optic nerve and the whole retina and all. So covering everything: normal, anatomy, physiology, physiopathology. What does the pathology look like? How do you test it? How do you manage? And remember, general rule of thumb is we go from non-invasive treatment to invasive treatment. So first of all, we want to see if we can modify a lifestyle. Before we talking about giving maybe some sort of glasses and all, before we talk about giving some medications like eye drops and all, before we think about a referral. And even when you refer, the the ophthalmologist and the other orthoptists and the other team will think about the non-invasive before they get into invasive surgery and all that. Okay. Now, one top tip I'll give you when you are going through the competencies is know what applies in your country, but also look into what applies in the UK. A strong candidate would always say, in my country, this is how we manage it, but I know in UK, this is how it's done. That is and I remember that you have done QC, quality qualification check, so they know that you are an optometrist in your country. The reason for which they are having a chat with you is to see whether you've been able to bring yourself to that place where you are now safe to practice optometry in the UK. This is the words of my mentor. She said to me, Adeze, I know. One thing you should know is that they know the kind of practice you have in your country. But they've asked you to write a portfolio because they want to see if you've been able to learn and to grow, to know how the various cases are, yes, handled in Nigeria, because that's where I practice, but now how does it happen in the UK? And she said to me, when you're presenting your cases in your logbook, you want to present your case according to UK standards. And yes, I had to go through a lot of tutorials. Yes, there was a lot of back and forward. I didn't do it on my own. But when I put in my logbook, that logbook was accepted first time. And it's the same advice I am giving you. Look into websites such as the NICE guidelines, the College of Optometrists website, the GOC website. All these websites are good websites where you can get information of how the UK handle different things. So as you're going through the courses, that is what you should be doing. You need to put a UK spin on the Nepal source, on the Nigerian source, on the Indian source. Yeah, that is what makes you stand out in the interview. All right. And for those of you that are listening right now and you are in the academy going through the accelerator program or the bootcamp program, you don't have anything to worry, because all the courses that we have and covering all these competencies picks on your experience as an international optometrist, and then it structures it the way you will be practicing right here in the UK. And that's why our candidates go on to succeed in these interviews, and not just that, begin to thrive in their different stores, doing their pre-reg and practicing without no headaches, no skin pains. Right. What are the common pitfalls? And I'll give you some pro tips as we go along. Number one, I think I'm talking too much. Do I have any questions at all? Oh, Christopher, nice one, doctor. It's helped a great deal. Okay, awesome. Happy that I would like to be groomed for the GOC as I'm a novice. All right, Christopher. Hi, thank you. Let me know in the comments, what have you done? Have you done your IELTS? Where are you at in the process? I like to know. And then I will quite happy to chat up with you, send you a link. We can have a chat and we get you going. All right. Now, pro tips. When you are asked a question in the interview and when you are studying, whatever you're studying, you need to think competency. What is the competency I'm being assessed? And link your answers, number one, to the main competency, and number two, to the indication in each competency. Now, obviously, my husband bought me a Pro MacBook, so I don't really have all my files here. Unless I would have loved to bring up a particular outcome letter. Maybe I will try. Because when you look at the outcome letters would say either proceed to pre-reg, or it would say proceed to pre-reg with trailing competency 3.2.1. Yeah. So when you are studying and when you're asked a question, You want to understand the competencies and their indications so that when they ask you a question, you hit all those indications. Do you get what I mean? I hear a lot of optoms, they come and they say, oh, I did my interview, I got an adaptation in contact lenses, but I'm very sure I answered the question that they asked me in contact lenses. The point is, could have answered the question maybe after ligmarolin, but did not hit the indications. This is the reason for which there's a lot of people going into the interview and coming out with adaptations. But you're listening to me today, so you're not making that mistake, okay? So you will link all of your answers back to the competency. Now, the second pitfall that optometrists fall in is giving textbook answers with no clinical application to a patient. Everything you're reading, you must be linking it to your patient. The discussion you're having with the assessors is not solely an academic interview. Yes, you're going to need the academics behind it because you need, the theory behind it, but you need to be applying it to your patient, the patient you saw in clinic, a patient. Okay. And the last thing which I talked about earlier was forgetting UK concept. A lot of people, I've done loads and loads. I've been coaching, I've been a GOC or a UK optometry qualification mentor for the past 10 years. And, sometimes when people come into, and not, it's not sometimes, every time someone signs up for our tutorial bundle, like our accelerator bundle, anytime I have a discussion with them, they're like, my goodness me, doc, I did not know that this is the depth I need to go when I'm sort of studying. For others, when I'm having a chat with them, they say to me, well, people don't play squash in my country, so I don't know. Well, people in my country don't have that sort of disease, so I don't know. It's the point is, you want to practice in the United Kingdom, isn't it? That's why you're doing your IELTS. That's why you did your QC. That's why you're doing your GOC interview. Haha. Even Paul said it in the Bible. When you go to Rome, you have to behave like the Romans. So you don't go into the interview just as a Nigerian optometrist, just as a Nepal optometrist, just as a Ghanaian optometrist, as an Indian optometrist. You go as a Nigerian optometrist, but a Nigerian optometrist that has brought him or herself up to the standard that I know what applies in the UK. Whew. As you are speaking, they are smiling, they are nodding their head, they are not palpitating because they know, okay, this one understands what we're doing here. Safe to practice in the UK, proceed to pre-reg. Not safe to practice in the UK, go for adaptation. Not safe to practice in the UK, go for rejection. But that is not going to be your case because you're listening and you're going to implement. Pro tips for your interview. Frame everything around your patient. Think aloud. Yeah, so that the assessors can follow your reasoning. But somebody will say, oh my God, what is she talking about? What if I don't know? That's why you're supposed to prepare well. Yeah. Practice mock interview. I say to every single person listening to my voice, if there's one thing you should not do before you go into that interview is not to book a mock interview. And I say it with not with pride, but I know what I'm saying. The least thing you can do for yourself to ensure that you go into that interview and you get it right, the least thing you're going to do on that list, oh, I don't want to spend too much money, oh, I don't want to do this one, oh, I don't have time for that. The least thing you're going to do is to ensure that you book a mock interview with the academy. One single session. If you go to our website, there's one single session. You book that one session, you come in, we take you through it, you see how it's run, you're sure that your answers are in sync with what is going to be asked, and then you're ready to go. And I will tell you 100% of the time, do not book that one interview when you've got an interview date. Do not book it. Once you finish reading, even before you submit your form, your application form, you want to book that interview. Because For every single person I have done an interview for, they are 100% away, far away from the type of standards that will get a proceed to pre-reg. So the earlier you do it, the better. Okay, right. The next thing, the last thing in this particular segment is use your real cases. Don't be thinking and joining and be thinking and joining, because there's something that we know, and it's quite interesting in the academy. When we come in, when you start in the academy, we do an assessment from right from day one. You get an assessment, and then we're watching and we record it. And then as you go through the program, we're also recording it. And you will notice that your face, number one, the expression on your face changes as you go along. Number two, where you are assessing also changes as you go through. So in the beginning, I ask the question and the eyes roll up, they're assessing their brain center. After a while, it's going up a little bit, but by the time we get to the 8-week mark, we're beginning to flow. It's beginning to flow. Everything is coming back, especially for those that have been out of practice. Maybe in the United Kingdom, they've been out of practice for a while, and even some people still practice in their home countries. It's a different ball game. The practice here in the UK is different. Okay, so I want to know in the comments below from you, based on all the competencies that we've shared, which competency do you feel the most confident about right now? I want to know. Let me see in the comments below. Let's see if there's a pattern. Which of the 8 competencies, which you can, maybe your own is all the 8, but I want to know the individual ones. Which one is the one you feel most confident about, and which one is your least competent? So most competent, sorry, and least competent. All right, I'm going to check the chat now if I've got any questions. No. What's that? That's a mistake. Ignore. Right. Awesome. Okay, good. I want to know in the comments below which one. And if you have a question, the time is now. I'm wrapping up. I hope you're getting some value out of what we're sharing today. So those are the 8 competencies that is going to make, I'm going to take away the break because you've heard me, it's going to make your GOC interview. Okay. Once you master them, you're ready, because they're not asking you anything else aside the interview. Now, I don't want you to think that because I'm saying there's no only in it. Okay, I'm not in my library now, unless I've just showed you some books that, the books that I have, the books that I used when I was going through my own journey, and the books that we use to create all the courses that are in the academy. So even though I say only, it's not only, because there's a lot of width and breadth. Do not make a mistake of waiting till you have been given a GOC interview date to prepare for your interview. Don't even make a mistake of waiting until you've paid the 450. Do you know when you start preparing for your interview? Right now. If the practice in the UK is something that you want to do, you want to start practicing now. Get started right now. Do you know why? By this time next year, this system that we're doing, just do an interview, go do your pre-reg and start earning in United Kingdom, it all changes. So if you are privileged to know about this route now, go for it. And if anybody is sending you any other route to practice as an optometrist in the UK, that is a fraudster. This is the only pathway. Application, interview, pre-reg, done. Okay? Okie dokie. Now, let me check one more time. No questions. I hope you're getting something from the program today. Okay, so I want to invite those of you that really want to, want to prepare, you want to practice, you want to present your competencies in a way that feels right to you to a 5-day one-to-one challenge with myself. It's called 5-day GOC Success Challenge. In those 5 days, I'll work with you for 30 minutes. And at the end of it, the same source that worked for me, that is working for my clients, is the same source that you will have, and it will be working for you to go and build and get to that stage where you will become that confident, competent, UK ready optometrist. It is 5 days. It's usually a paid sessions that I do, but right now it is free. I've still got some free spaces available. Um, so if you are interested in going through that 5 days, you must be committed though. That's the catch. You have to be committed to working for 5 days, 30 minutes a day. There's no time because the timetable is there. You will pick the time that is suitable for you. I want you to comment in the comments GOC. So if you want to pick up one of those free space, and even if the free spaces are gone and you have to pay for it, but I'm 100% sure that there's going to be some space for you at no cost, because I'm really committed to helping these number of optometrists. But once I get to my 100 mark, then obviously things change. So you want to be part of that one-to-one. I want you to DM me the word GOC, comment GOC in the comments below, and I will get back to you. Let me see. Any questions? Any questions? Let me see. Any questions? Okay, Somalia. Okay. All right. Awesome. Semi. Okay, GOC. Amazing. I'll reach out to you. Good, good, good. Da-da-da. Right. Let's go. Okay, good. All right. So, in the absence of any other question, if you're watching on the replay, drop your questions in the comments below. And if you want to partake in that one-to-one challenge, 5-day GOC success challenge with me, it is free, 30 minutes a day, but you must commit to attend and you must commit to the homework to get yourself into that space where you'll be ready to succeed in this GOC journey. Is GOC in the comments below? Is GOC? DM me the word GOC, catch me on WhatsApp GOC, and then I will reach out to you to get you started ASAP. All right. So I want to say thank you so much for coming out. Before you go, could you do one thing for me? You know, I've been sharing with you for the past 30 minutes, and it stayed again, isn't it? It's static. Kindly share. Can I see you share? Can I see you just give us some likes? Can I see you commenting? What that will do is you're going to help me reach out to more international optometrists, those that really want to qualify, that really need the right information that will save them time and money. I want you to share the stream, share it on your platform. Be not ashamed. It's helping someone the same way you are receiving these goodies here. Be generous and share with someone. But remember, the GOC interview is definitely not to catch you out. Now, I am an assessor, and it's easy for me to say pass than fail. Not GOC assessor. I do GOC assessments, but not for the GOC. I do it for the company I work with internally. And it's easy for me to write a report when somebody has passed because it's very few words. When someone hasn't passed, there are too many things to write. Why did they fail? What is the feedback? What do they would need to work on? But if I say pass, that's it, we're done. And it's the same thing with the assessors. The assessors will be happier to give you proceed to pre-reg, than to give you an adaptation, because then they need to start writing out the reason for which the adaptation or rejection needs to happen. So it's not to catch you out. It's just there to confirm that you are safe, that you are confident, and that you are ready to practice in the UK. And so with the right preparation, you definitely will pass. Okay. Now, remember, this is day 2. How is it going so far? How many of you were there yesterday? Maybe you joined the live on TikTok or and all that. How is it going? Are you getting any value out of these days? Yeah, cool. Just to say that doors are open. We are starting the next cohort in our accelerator program on October 5th. And so if you really want to be part of that program, the program is very robust and it guides you from application form, even from self-assessment up until you get a job in, in practice. So if you really want to be part of October cohort, some have already started. Right now, what we're doing is we're doing application forms, getting IELTS sorted, getting documentation, QC, things like that. The courses are already there, they're going through, and then October 5th will be the onboarding session and they get started with tutorials and all. If you really want to go through that robust program, yeah, you can just put accelerator in the comments below or DM me and say, yeah, I really want to come into the academy and be somebody use the word groomed. Yes, I want to be groomed. And I tell you, grooming really works. The same way I was groomed and I continue to thrive is the same way candidates in the academy are groomed and they become not just UK ready, but they become internationally ready optometrists, thriving in the GOC interview, thriving in store interviews, thriving in the UK. Then definitely you want to DM me and I'll send you out a link. We come on a call, we have a call, and then I know your personal circumstance, and then we get you started. Okay, awesome. So I was just going to share with you, what are we doing tomorrow? Let's have a look. Do I know what we're doing tomorrow? Let me just check for you. Oh, nah, I don't know. Let me just see. Bear with me 1 second. I need to check. Let me see. What are we doing? Who knows what we're doing tomorrow? Let me check. What is it tomorrow? I can't see. I have no clue. What are we doing tomorrow? This is interesting. Okay, I'm just going to read out. We've got 3 more days. We've done 2. Yesterday we did why most international optometrists waste 6 to 12 months on the journey. And so we've got, I don't know what we're doing tomorrow. I don't know. Maybe tomorrow is evidence documentation and what the assessors are looking for in your application form. Not sure. But we've got that to come. We've got turning overseas cases into UK standard. We're going to do a little bit more practicals on the interview. I think that's coming up as well. Bear with me 1 second. I've lost my screen. Let me see. And then, okay, we've done the 8 competencies. Just bear with me. So we've done that. We've got evidence coming. And I don't know. I think it's evidence and documentation. I'm sure the VA has already. And then we're going to talk about time, money, visas, jobs, and things that you can be doing to position yourself, turning overseas cases into UK standard case. So we've got interesting things coming, almost workshop style, but we're doing it on the live. And I know that all these lives that we're doing are going to be so helpful for you. Okay, good. So who's here? Thank you so much, all of you that came out to listen to me. It's amazing when you cook this lovely soup. You got someone eating with you. Emanuela says, thank you so much, Dr. Deze. feel quite motivated now. I'm amazed at that. Yes, useful information yesterday and today. Awesome. And Nehemiah says, this is great. Nehemiah, this is great. A nice one, doctor. It has helped a great deal. I would like to be groomed. Okay, I think that's where I led you. I would like to be groomed. The GOC Accelerator program is your grooming program. So I'll reach out to you with a link. You can book a call on the calendar and we get you started. Remember, the next cohort starts 5th of October. And if you want to be part of that one-to-one, yeah, 30 minutes with me, there's no cost to it at all. 30 minutes working on the 5 days GOC success, just you and me, one-to-one on Zoom. You want to comment GOC below and or DM me the word GOC. Just chat me up and then we can see where you want to go. Okay. I wish you all the best. I'll catch you lunchtime tomorrow on TikTok and 7:30 again here on all other platforms. It's been a pleasure. I say a big God bless before you clock out. Like, share, comment, and I will see you tomorrow. Take care.